You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have oral surgeon, Dr. Chaudhry. Dr. Chaudhry, welcome to the program.
Nice to be here.
Good. Now, I know you brought some photos, so we'll get to those in a moment. Now, for people that don't know your practice, I mean, you really do focus or specialize in implant dentistry. Who's the typical patient that's coming in for this?
Well, Randy, I don't know if we have a typical patient, but they generally fall into two categories. First is a person who's been wearing dentures for 1 year, 5 years, 10 years, and they're just getting frustrated with their denture. It doesn't fit, it's loose, it's giving them sore spots, and they want something that's actually fixed in their mouth.
Okay.
So that's the first set of patients. The second set of patients are people who have gone through years and years of dentistry. They've had root canals, and they've had failed root canals, and crowns, and bridges, and now things are just falling apart. And they know that they're headed into dentures, but they are afraid of them.
They don't want dentures.
They don't want dentures, and they want something that's going to stay fixed in their mouth.
Now, we talked on the telephone, and you say the denture wearers, you can almost help the most, but it's tough to get them in.
Yeah, Randy, one thing that happens is that once you get a denture, you are almost out of the system. You're out of the dental loop. And so you may not see a dentist for years after you've gotten a denture. So you may go every now and then when the denture starts to really not fit very well for a reline, or when things start hurting and you need a little adjustment in your denture. But other than that, you're not going to be seeing a dentist regularly. And
So you don't know your options? Is that what you're saying?
Yeah, you're not going to be told by your dentist what the options really are when it comes to getting something that's fixed in your mouth, or being able to chew better than you actually can with a loose-fitting denture.
So is this true? I mean, in certain cases, people can walk in, no teeth, on the day of the procedure, and walk out with upper and lower teeth that don't come in and out?
Absolutely.
Really?
And that is what we do in our clinic day after day. And we've had patients who couldn't believe it, just like you initially, but when they come in and were able to do the surgery, they had a denture that was not fitting them well at all for years, and they walk out with fixed teeth that they can eat, chew, and smile with. And
Wow.
That is the goal of our clinic every single day.
Now, but what about that other group of people you were talking about that have really bad teeth and bad gums, like the bleeding gums, the gum disease? Are their gums too bad to do dental implants?
Not at all. And those are actually some of our best patients, because when you have bad gums, it's due to bacterial infections that are being caused around the teeth, the bad teeth that you have. So when we take those teeth out, we clean out all of that infection on the same day as the surgery. And then we go ahead and place those dental implants and give the patient fixed teeth and get rid of that infection for good.
Is that right? Now, you have a concept at your center. I guess how it's normally done is two different offices. You do it all right there with the general dentist as a team. Tell me about that.
So patients don't like to go from one office to the other office to the other office. And so what we do is we collaborate with general dentists in our area who have refined their skills in this particular technique. And we ask them to come to our office to continue with the restorative steps after the first major surgery has been done. And so that way we can make it easier for the patient. Now, in some cases, if they want to go back to their general dentist and to their office, they can do that as well. We're fine with that because we work with lots of general dentists in our area.
Now, you say it changes people's lives.
Yeah, I had one woman who came in and she would not even let me examine her mouth without her husband stepping out of the room, because her husband had never seen the shape of her teeth. And we did the procedure for her, and her husband came back a few months later and said, she's a completely different person. She now is socially engaging. She smiles. And the patient told me that before I used to walk into a room and hope that no one looked at my mouth, no one looked at my smile, and I covered up my mouth whenever I smiled. And now I get compliments left and right.
Nice.
And that's the way that we change people's lives.
Now, the denture wearers, back to the denture wearers for a moment. Are there a lot of people where, like in your area, your county, that have an upper lower denture?
Yeah, I mean, we have the PP&L Center big center that has hockey games and other major concerts, you could fill that PP&L center 20 times over with people who just wear dentures and who are unhappy with their dentures. So there are lots of patients who have dentures right now.
I mean, then if dental implants are so good, then why is everybody doing it? What's your take? Why aren't these denture wearers doing it?
It's a great question. Well, I think one of the reasons is that they're just out of the loop. That once you get a denture, you're finally relieved of not having to go to the dentist over and over again. Let me tell you about what a denture wearer actually has gone through in their life before they get a denture. So for 10, 15, 20 years, they've been going to the dentist in and out over and over again. They've been getting a root canal and the root canal fails. They've been getting a crown, the crown falls out. They get one extraction here, a couple of extractions there. They're in pain throughout all of those procedures.
Plus it's expensive.
Exactly, and the costs keep rising up and up and up, and dental insurance just isn't very great anymore. And they're fearful. They've gone through a lot of pain over the years, and now they're thinking, do I really want to start that process again and going to the dental office over and over again?
So it's hard to get the denture wearers back in.
Exactly. And
so
then
they're afraid, obviously.
Yeah, and then they've also maybe been told by other doctors that they're not candidates because their denture wearers lose bone.
But isn't that true? I mean, if you've been wearing a denture for like 20 years, you can't do this because you don't have enough bone.
Absolutely not. And the fact of the matter is that with the technology that we have now, we can place dental implants in very minimal bone.
So you don't have to really turn people away for that problem.
I have seen hundreds, if not thousands, of dental implant consults, and there are almost no patients that have turned away because they don't have enough bone.
So what do people like the most? Do they like the way it looks, like their new teeth, or do they like the fact that they can chew whatever they want?
Yeah, so we've got, patients fall into two categories. You've got the one category who are only concerned about the looks, and they want that perfect smile, and they don't really care about what they'll be able to eat and chew, whether they can eat salad or broccoli or bite into an apple, and they're not so much concerned about that. But then we've got the patients who are very concerned about function. They want to eat that steak. They want to bite into an apple. They want to have that, salad that they haven't had for 15 years. And they're not so concerned about how the teeth are going to look. And when we do this procedure for them, the people who are very aesthetics and very into the way that they look, they're blown away by what they can actually eat now. And they are, they're eating and they're telling us about what they eat at the follow-up appointments.
Okay.
They're actually telling us, I had a burger the other day, which I've never had without cutting it up before. And now I can just bite into it. So the other group, which were more concerned about what they would be able to eat, now love the way their new teeth look. And they're getting compliments right and left. And they are equally happy with the look as they are with the function.
So how old can you be to do this?
So my patient that I recently did was 92 years old.
Jeez.
92 years old.
Why would a 92-year-old want to do this?
She told us that she wants dental implants. She needed her teeth out, and we'd given her all the options. And she said, why would I want something removable in my mouth? I haven't had something removable for 92 years. Why would I want to start now? And we gave her teeth on that upper arch, and they looked beautiful. And they were fixed, and she was able to smile, and she was able to eat whatever she wants because she has fixed teeth.
So it doesn't matter. So you can be 90 years old. Statistically, they're not more likely to fall out? Or anything like that?
No, age really doesn't matter anymore.
Okay.
As long as you are able to, as long as you don't have any debilitating medical illness, you can have dental implants that will work at any age. And people want to eat no matter what age they are. If you're a 75-year-old, you're not going to suddenly say, I only want to eat soft foods because that's what my denture is going to allow me to do. Wow. They want to eat food and good food as much as a 25-year-old.
Now you're an oral surgeon, so you probably think that the teeth are the most important thing, or a nice smile is a very important thing. How important is the smile as you see it?
Randy, it's not just important to me. We live in a society where teeth matter. When you have some part of your body that you're not happy with, you're held back. And whether it's a nose that you're not happy with and you walk into a room, that's what you think everyone is looking at.
Yeah.
But when you have teeth that impede you from smiling, then you're hiding something. And a lot of denture wearers or people with bad teeth, they have this secret and they don't know how to tell other people about it. They don't want to. And so what we try to do is set them free from that secret. And so they don't have to be held back, and they deserve to be free. And that's what we're trying to provide for these patients.
Okay, good. Now we're going to take a quick break. We come back, we'll get to your photos and a little bit about the process, what people can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
My name is Joe Horwath, 46 years old. I actually came to Dr. Chaudhry about 1.5 years ago. My teeth were in bad shape. I'm diabetic, juvenile type 1, so my teeth were getting bad. They were actually falling out to the point where I couldn't eat, I couldn't smile. It was embarrassing.
About 10 years ago, I had lost a daughter, and I really didn't care about smiling again. But as the years went by, I wanted to smile again. The whole time before, I would spend looking at people's faces and hoping that they didn't look at me in the face, because I was nervous about them seeing my teeth then.
I actually found a postcard in the mail and called on a weekend and actually got a response right away saying, let's get you in, let's make an appointment and see what we can do for you. I chose the all-on-4, which was total tops and total bottoms with hip implants in both my upper and lower jaw. It gave me back close to 100% of use of basically my mouth and eating and being able to smile again and not be embarrassed. The procedure went extremely well. There was no pain whatsoever I had during the whole process.
I wasn't awake that long, so when I woke up and it was done, the whole crew was there smiling with me. And I one chuckled, and I think it's because I actually cried looking at myself in the mirror. Then it was a whole different world. I could smile. I wanted to smile. I looked to have a conversation with people just to smile. I could meet people, see people. I didn't feel inferior anymore. It literally changed my entire life.
It seems now like I have possibly the full package, now that even just the smile part of it, it exudes my self-confidence more. And I like to portray that sometimes.
Now I can eat steak, I can eat corn on the cob was my biggest thing, because I used to have to take them off because I couldn't bite down hard enough. And it's amazing the way I can eat now. I think that's probably why I gained like 20 pounds since I got them in, but it really is a big difference. It's amazing that I can eat. I can enjoy food now.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to oral surgeon Dr. Chaudhry, he says nobody should be wearing a loose-fitting denture. Okay. Now, you brought some photos. So what are we looking at here?
Sure.
And these are your typical patients, kind of thing, who you see all the time?
Exactly. So these are patients that we see in our office all the time. And, the first gentleman, he's in his 30s. And he's a
That's got to be
professional.
unusual.
Well, it is kind of unusual because these people are covering their mouth all the time. So the people all around them don't see the
So this is
condition
common? Like you see stuff like this?
Yeah, in the office we see it, but they are great at hiding what's in their mouth. So they're covering up their mouth and so forth. So this is a patient who's in his 30s, professional, does well at his job. However, he's got teeth like this. And if he were ever to smile and people were to see exactly what his teeth look like, he is very embarrassed. And because he's embarrassed, he's lost a lot of that charisma. And when he came to see me, he was kind of soft-spoken, not really outgoing, and just wanted some sort of help. He's got a bacterial infection that's going on in there. He could brush his teeth all day long and he will never get rid of that bacterial infection that's in there already.
So this guy was headed to a denture?
Absolutely.
Like that was his option? He couldn't save those teeth?
He was in pain every time he ate almost anything. His teeth were loose. He was afraid if he bit into an apple, the teeth would come out. And so that's what he was living with on a day-to-day basis. And finally he had enough and he came to our office for a solution. So he went from that to a full set of teeth the same day, upper and lower, that were fixed in his mouth and were not going to move around like his current teeth.
Okay.
And these are his
big difference.
temporaries the same exact day. One surgery and he was done. he never had to go through another surgical procedure again. And so he was ecstatic about that. And he came back the next day, and I saw him and I asked him, so are you in pain? He said, I didn't have any pain after this. Now, everyone's a little bit different. Some people have more pain than others. He underwent a nice, reconstruction, and he had no pain whatsoever.
Nice. And he could eat like whatever he wants?
Exactly.
How soon can they eat after the procedure?
So,
if everything goes right?
Yeah, so they can eat soft foods right away. And we encourage them because they have to start eating right away. We want those implants to heal for a few months, and once they've really locked into the bone, he bites into apples now. He's able to eat salads. He's able to eat steak.
So
he
whatever
can
he
eat
wants.
whatever he wants at this point.
Now, that smile, because you said they have to learn to smile.
Yeah.
That kind of looks like a grimacing smile. I mean, I'm not putting it down, but
Yeah.
you say it softens up after a while. What do you mean?
Absolutely. I mean, this patient has not smiled for 10 years. And so all of his muscles in his face have to be reprogrammed as to how to properly smile.
Okay.
And, he was embarrassed, so he would hide his teeth by not smiling for years and years and years. And now he's got something great behind his lips. He just has to learn how to show it now.
Nice.
And when that 4 to 6 month mark hits, they're smiling like there's no tomorrow. And they want to show those teeth to everyone. And he comes back to our office now, and he's talking to our front desk girls. He's talking to, our assistants. He's telling them about his life. He's no longer the same person that he was before the surgery.
Nice.
And that day of the surgery was literally the first day of the rest of his life.
Wow, good.
Well, let me show you this
Good
other
story.
patient. This is
my
a
goodness.
woman in her 30s.
Oh, wow.
And again, she refused to show even her husband the state of her teeth. And we have lots of patients whose spouses don't even know what's going on in their mouth. They've done such a good job of being secretive. And obviously with these broken teeth, she can't eat into anything. She can't bite into a carrot. She can't bite into an apple. And she's constantly in pain because these nerves are exposed in her mouth. So she wants to be out of pain. She wants to be able to smile again. Her options were a denture. And she's in her 30s. There's no way she's going to have a denture for 60, 70 more years of her life.
Okay.
And so we gave her the option of fixed teeth. And that's what she opted for. And this is what we did for her afterwards.
Oh my God, that's a pretty smile.
Look at that smile. I mean, it is aesthetic. It is, pleasing to the eye. And compare that to where she was before. The new smile has, perfect display of teeth. The teeth are nice and bright, and they have little ridges which make them very, very realistic. So this is what we do. We do cosmetic dentistry on the whole arch of the teeth. And imagine what she's, judged as with the new smile. She's probably judged as being more educated, more articulate.
That's a good point. I mean, it's definitely a prettier smile. It looks healthier.
Yeah, and that gives her confidence. And so once a person has confidence, then they can do whatever they want to do. And they can become the person that they really are. Rather than being trapped by bad teeth, they feel free, and now they can kind of, blossom into the person they really are. And when she saw this in the mirror for the first time,
Like in the chair, you give her a mirror.
we give them a mirror and they look at it and they are blown away. And we routinely see, tears of joy coming from them because they're so happy that they've had this transformation.
Now, we should mention, so you're doing sedation, like most of these people. As an oral surgeon, you're doing IV sedation?
Yes.
So they don't feel anything during the procedure, but
Exactly.
like they almost don't even remember?
Yeah, so
Sometimes?
every patient has this done with IV sedation, so they feel zero pain during the procedure. And they typically don't even remember. So they feel like they had a procedure done in 5 minutes when it might have been a few hours.
Okay.
And so they don't have to have any of that anxiety before a dental procedure that how many shots am I going to get? How much pain am I going to feel? They don't feel anything during the procedure. And then after the procedure, everyone's a little bit different, but some patients, they take some Tylenol, Advil for a day or two, and then they're fine.
Okay.
And they do remarkably well after this
So
procedure.
because it's like having their own teeth, so how do they maintain them? They still go to the dentist?
Yes.
Or it's at-home care?
Nope, so they come to the dentist every 6 months, just like everyone else with their own natural teeth. and we clean them and we check them and we make sure that the implants are doing well. They'll get some x-rays done so we can evaluate everything that's going on over there. But they're back into that dental loop, and they need to be seen on a regular basis. I have this other patient. This is a remarkable story. This is a man who was a drug addict for 15 years, and he cleaned up his life. And when he came to our office, he was clean and sober for 7 years. But his teeth had deteriorated over the course of his addiction. And now he had turned around his life to the point where he was a mentor to others. So he was now a motivational speaker. And he wanted his teeth to reflect that motivation by smiling regularly, and he just couldn't. So his option one was a denture. And there's no way he was going to have a denture. He had to speak every single day to people. He did not want loose teeth while he was speaking in front of hundreds of people. And so in one afternoon, we took those teeth and we switched them to this.
Very nice.
And now, again, this is the first time he's had these teeth, so he's trying to figure out how to smile properly. But his teeth now give him the confidence to go in front of an audience and speak without any hesitation, and to tell about his story and inspire other people to get off of addictions and
Nice.
to make their lives better.
Now, the way you do it, you do guided surgery. It's not always done that way in the world of dental implants.
Yeah.
Tell me about that.
So guided surgery is the latest technology in dental implants. Think about a dental implant as a little screw that we have to put specifically in a very specific location in the bone. So a lot of dentists, they're opening up the gums and they're looking at the bone for the first time. And they're trying to figure out where there might be enough bone to put in those dental implants. What I do is I get a 3-dimensional x-ray before we even start surgery. And I plan out all of my implants on the computer before we even get to the day of surgery.
Okay.
So I've got everything planned, and I make a surgical guide, which is basically a template for where the implants need to go for that specific patient, so that we can execute that surgery faster and more accurately, and the patient has less post-operative pain. And it's a successful surgery because we get those implants exactly where they need to be.
Okay, time for a couple more photos.
Sure. This is a lady in her 60s who has gone to the dentist all her life. She's had bridges, she's had root canals, she's had some extractions, and now everything's just falling apart. And she came to me and said, look.
How old is this person?
She's in her 60s.
Okay.
And
because it makes her look much older.
Absolutely.
Even though I can only see her teeth.
Yeah, and she's got teeth that are mismatched. This is patchwork dentistry. So you've got a crown that's nice and white, and you've got teeth right next to it that are yellow. And there's no way she wants to smile with this set of teeth over here. And so her option was to get all of her teeth out and get a denture, which she absolutely did not want.
Do they tell you that? Like, Doc, I don't want a denture. I don't want teeth that come out.
Yeah, they've heard the miserable stories of their parents or their other friends who have, lived through dentures and using all that adhesive and glue to try to keep them in place, and, going out to dinner and being embarrassed that you have to go to the bathroom to clean your dentures. Who wants to have someone walk into the bathroom while you have your teeth in your hand?
Wow.
No one. And so she knew all of that, and she wanted something fixed in her mouth. And so on one day, we did the surgery, we took her teeth out, we placed the implants, and we gave her her fixed teeth the same day.
Very nice.
And so that smile tells it all. I mean, she's confident, she's happy. She is no longer afraid to show her teeth. She's a whole different person, a whole different personality when she comes in. And she just can't wait to smile to our staff, to me, and it's changed her life.
Is this one of those things, where they're going, I really should have done this years ago? Because you said people hold on to their old denture too long.
Yeah.
People, I guess, avoid going to the dentist for too long.
Yeah.
Right? Until they just are in so much pain, they have to call you guys.
I've had so many patients tell me I should have done this 5 years ago. I should have done this 10 years ago. Better late than never, but if you can get this done earlier, your quality of life is going to be better for a longer period of time. So,
okay, good. One more. We have time for one more.
So this is another professional gentleman who just has crooked teeth, broken teeth, and just doesn't want to smile. And he's embarrassed by how his teeth look. He's got spaces in between the teeth. He's got chips on many of the teeth, and he just does not want to, show people what he's going through. He's still able to eat whatever he wants, but he just is not happy with the aesthetics of his smile.
So but this is a guy that would have had dentures.
Oh,
Like,
absolutely.
he couldn't save those teeth.
He could not save the teeth in the condition that they are.
Okay.
So he's just got too much going on over there. And this is, in one single day, we're able to transform him into a perfect set of teeth. And so now, as a professional, he's able to go to his clients and smile and show that confidence that he has when he smiles.
Now, we should mention, Medicare, Medicaid does not cover the cost of this. Even with the best dental insurance, it's not covered. The whole thing's not covered.
You're right, but we have patients who finance this. We have lenders who specifically we work with that finance dental procedures.
Okay.
And we have people in our office who specifically look at how we can get the funds for financing this type of procedure. We had a patient who worked through her own bank and got a loan, and she said afterwards this is the best money she's ever spent, because now she's back to smiling and being confident and eating whatever she wants. She wished she had done it even earlier.
Okay, good. Now, final message. Somebody watching this, right? Maybe they've got teeth that they've been told they're going to head toward dentures. They have to extract, or the denture wear. But for whatever reason, they're afraid. Maybe they've heard what you have to say, but for whatever reason, they're still saying, I don't know.
Right.
Maybe I'm too old or whatever. What do you say to them?
Yeah, Randy, I invite them in. Come to our office, see what options you have, and see, what we can do for you.
Do they need a referral to see a specialist?
They don't. They can
So they
come
can call you
directly
directly.
to us. Exactly. And we invite them in and, see our office. We're not intimidating. We're going to be open to you. We're not judgmental. And we're going to, give you all your options. And in the end, you make your decision.
Now, general dentists will watch this show, and you work with general dentists. What do you want them to know about your practice and dental implants?
Yeah, that we're working in conjunction with them on a daily basis. And if they have patients in their practices who have these type of problems, we welcome them, invite them to come to our office, send them to our office so that we can talk to them about what their options are.
Okay, good. And on these consults, so they get to see you?
They do. They do.
Okay.
They get to see me personally, and I can talk to them about their specific situation.
And how soon from when they walk in the door, how soon before you can say, we can do this? Like, it'll work for you?
Yeah, so I can tell them on that day itself.
Okay.
So, after we get the appropriate diagnostics that same day, I'll sit down with them and tell them if they're a candidate or they're not.
Okay, good. I want to thank you for coming to the show. Great stuff.
Thank you.
And the photos are on the website. There's some video testimonials, and I guess just make the call.
Yeah.
All right, thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.